everyone, and welcome to our update on Tuesday, December 15th. I'm very excited to share that this morning the first Philippines received their vaccinations protecting them against COVID-19. And in the days, more than 100,000 frontline healthcare workers across our state will join. I want to offer my appreciation to the incredible network of IDPH and IEMA staff, state troops, hospital administrators, healthcare workers, and logistics coordinators working furiously as we speak. The vaccination go as smoothly as possible. The good news was buoyed this morning, the FDA releasing its analysis of the Moderna vaccine ahead of Thursday, the vaccine advisory group to discuss the this vaccine, just as they did last week for Pfizer. As expected, based on the public data, the FDA found no serious safety concerns with the Moderna vaccine and affirmed its 95% efficacy. That breaks down to 96% for those between 18 and 65, and 86% for those above 65. By all likelihood, this means starting will include both the Pfizer and Moderna. And Dr. Zeke will continue to update you on the progress as more and more of our healthcare workers receive vaccines to protect themselves and their loved ones. Today, I want to provide another update of state finances as it relates to COVID-19 and beyond. As you all know, the pandemic caused every state in the nation to face tremendous revenue shortfall. Illinois. Virus created job losses that have been seen since the Great Depression. The financial damage to families across America means for purchases of goods. Our travel and tourism industry has been decimated, causing the restaurant and hospitality industry to suffer mightily. And all of that has not only severely impacted families, but also states. For example, Florida has projected more than $5 billion in losses, leading Governor DeSantis to declare the resulting budget cuts murderous red scene from game. In the first 6 months, our neighbors in Indiana lost an even greater percentage of their state than we did in Illinois. Losses were 8 times a year. Already cut $1 billion from K-12 alone. In Illinois, the loss of state tax revenue from COVID-19 will cost us in excess of $4 billion over 2 fiscal years. I have worked with governors of both places and can count this time with Member to aggressively advocate for direct federal support state and local governments who lost billions of dollars in revenue due to COVID-19, making up for the missing dollars that fund schools and pay caregivers and first responders and support services in need. State below COVID, and the Congress needs to act. The damage that COVID has wreaked on our state, know all too well. Fiscal health required intervention long before this. Yet before I was elected, little had been done to address it. And lest you think the blame rests only on one party, remember it was the Republican administration of my predecessor, Bruce Rauner, along with his Republican supporters in the General Assembly, that left behind a multi-billion-dollar deficit because of their unwillingness to accept a compromise. And in doing so, they severely damaged the lives of the most vulnerable children and families in Illinois. You might say this suffered a 2-year Republican-induced crisis before we ever got to COVID. In 2018, I ran for governor with a commitment to propose long-term fiscal solutions. I have done that. Indeed, expanding discounted pension buyouts, consolidating police and fire pensions, and negotiating employee healthcare savings are just a few of the changes that I've already implemented to save taxpayers money. And there's more to do. I continue to believe that in addition to running government more efficiently, the best way to address our structural challenges is to fix the unfair tax system. Instead of giving advantages to the advantaged people, we should give a tax break to working people and require the wealthiest among us to pay a little bit more. That would have begun to bring structural balance to the state's budget. Republicans, both inside and outside the roll estate, fought tooth and nail against the best solution for our working families, lying about what the fair tax would do for our state, pledging their allegiance to the wealthy, and throwing lower and middle-class families under the bus. The same people that funded the campaign against the fair tax have proposed taxing retirement income. I think that's wrong, and I'll continue that as I always have. It's been 2 years since Republicans announced wholesale opposition to the fair tax, and it's been 30 days since the election. And they have yet to produce any viable answer for balancing the budget. They worked and endlessly to defeat the best option Democrats put on the table. After all their bluff, it turns out that Republicans have no plan at all to put the state on a firm fiscal foundation. In the winter deafening silence, our challenge remains. We have a projected budget shortfall of over $3.9 billion for this fiscal year, nearly $2 billion of which was created by the revenue shortfall from COVID. The remainder is of a structural nature. Ability that we get assistance from the federal government for COVID losses sometime during this fiscal year. It's the rest of the deficit that must be our focus right now. Today, the first step toward balancing the current budget over $700 million in initial cuts to our executive branch agencies. These are cuts that are under my control to make as governor without help from the General Assembly. This gets us part of the way toward addressing the budget deficit. For additional and more permanent balancing of our budget going forward, I will work with the legislature. But make no mistake, legislative action and is required. While short-term federal help may yet come, we need to take action to maintain fiscal stability over the long run and address the problems that plagued Illinois pre-pandemic. Over the years, state government in Illinois has been notoriously hollowed out. For example, there are approximately 25% more state government employees than there were 2 decades ago. All state government spending on education is now among the lowest in the nation. And while there used to be 3,000 Illinois state police troopers patrolling 58,000 square miles of Illinois, there are only 1,900. If anything, our schools and our public safety and healthcare deserve more investments, less. So cutting our budget will be, by its very nature, painful. The executive branch alone cannot legally address these multi-year deficits unilaterally. So continuing this with leaders and members on both sides to identify their best to make up deficit, bring long-term and balance to our state foundation. I have an open-door policy. I'm more than happy to have a conversation with legislators interested in a substantive effort. In the time, the cost-saving measures I presented today have already begun implemented. In addition, my staff is in conversations with AFSCME to discuss furlough days and cost adjustments, personnel cost adjustments that will help us reduce spending by $75 million. By definition, taking employees off the front lines will slow the delivery of services to our residents. but this is the place we find ourselves today. It pains me to pursue these actions because these employees are public servants who dedicate themselves to improving the lives of the people that we all serve. Often these are those who are most in need of help. Many of these employees, such as our corrections officers, who put themselves in harm's way every day before the pandemic, now go to work with the additional danger of COVID-19 facing them. They have more than earned our appreciation and our admiration for their dedication and hard work. The reason why these cuts are painful. But like I said, opponents of the fair long-term solution put us in this situation. And there's only so much on the table to choose when you have government as hollow out as come from state agencies, most significantly from the Department of Corrections. The number of incarcerated in Illinois has decreased by more than 1,000 individuals since the beginning of 2019. This presents an opportunity for real savings this year and in future years. It's a critical opportunity to transform our prison. I will be forming corrections transformation advisory team to determine the best ways to move forward with these efficiencies. I've also previously announced a number of additional criminal justice reform priorities that further reduce prison populations as we seek to pursue greater fairness and equity for all Illinoisans. As we often see when we move away from expensive, ineffective, and punitive models, this will likely also occur for additional long-term savings. Early on in our battle against COVID-19, my administration is on non-essential state government hiring and on travel. Those continue today and will continue indefinitely. I have also implemented a significant reduction in vehicle and equipment purchase. I've asked all departments to maximize the use of technology to reduce in-person gathering costs, even once travel is deemed safer. We're also making adjustments to the care program and the service provided there to older residents, including delay and rate increase initially for January 1st. I admit that this was a challenging decision because of how vital our community care workers are for our seniors. It must be undertaking the result of the deficit. I'm also freezing and reducing grant at a number of agencies, including the Department of Natural Resources, the Department of Agriculture, and the Department of Commerce and Economic Opportunity. That includes freezing 2020 grants for local government park and open projects, implementing freezing partial reductions on most grants at DCEO, and pausing issuance of school maintenance grants dependent upon casino gaming revenues. I want to be clear. Because tax fairness was off the table, there will be a human impact here. And while we've scoured the budget for ways to cause the least pain, I'm sorry to say that we simply cannot prevent these losses from touching the lives of our residents. We just can't. These cuts reflect the phase of our path forward, doing what is within my powers unilaterally without the legislature. It's going to be tough. And as my ongoing conversations with General Assembly leaders would indicate, there is a great deal of work the legislature must do when it convenes next month. At the beginning of my term in office, I've worked hard to bring solutions to the table, doing the hard things that must be done fiscal in order, including bringing efficiencies to lower the cost of operating government, working to reduce the budget pressure of pension liabilities, investing in the expansion of revenue-producing industries, and acting our prime economic assets, our college and seniors, to stay in Illinois rather than go to college. I promise Governor Allen's budget begins paying down the bills that my predecessor left behind. I promised to invest in education, training, and job creation. Before COVID hit, we did that. And despite all the challenges, I'm confident that we will continue our ascent to economic strength and fiscal stability. We will find a way. And while there is no easy path forward, I promise that we will get through this, working together as people of goodwill, with a laser focus on for the working of Illinois. For hearing the proposals for realistic cuts and balancing the budget. Thank you. With that, I'll turn it over to Dr. for today's medical update.
Experience to witness today's first COVID-19 vaccination being given here in Illinois. And I want to encourage people to be vaccinated when the vaccine is in fact available to you. Vaccination in general can be a polarizing topic, and COVID-19 has seemingly widened this divide. It may have appeared to come out of nowhere. Although the virus that causes COVID-19 is new, there are other strains in our communities. In this sense, coronavirus has some similarities to influenza, that there are different types of disease. We can see one that can pop up that's novel, H1N1. An effective H1N1 vaccine was developed, and an N1 strain has continued to be included in the vaccine to combat influenza every year for the last 10. To create safe and effective vaccines in a quicker time frame grows with every year. Science has evolved so that it takes as many years to vaccine. That's news for the world of modern medicine, people who benefit from it. As the vaccine continues to roll out, I'll do my best to dispel myths and the misinformation surrounding it. For one, the vaccine does contain a evidence to show infertility. Getting the vaccine cannot result in COVID-19. It can be easy to on Facebook or other social media portals and take it at face value. Perhaps someone has heard that it's not real, and therefore there's no need for a vaccine. During these very difficult times when we're all looking for answers, I do want to look at the larger body of work from and medical researchers. Don't look at just one article, look at several articles to see where there's consensus. Since yesterday, we've received a report of 7,350 individuals newly diagnosed with COVID-19 for 1,477 total cases. Unfortunately, we also report 107 additional deaths, bringing the number of Illinoisans lost to COVID-19 14,509. Overnight, hospitals reported 4,965 patients with COVID-19, 157 with the ICU, and 598 were on ventilators. Last 24 hours, almost 83,000, 12 million total tests. We are starting to get the right. So many of you have sacrificed and employed public health mitigation, and I thank you. That has gotten us to where we are. We still do have many more months to go, but let's continue light at the end of the tunnel. Vaccination, as well as the public health behaviors that you've already undertaken, will get us there, and they'll get us there. Thank you. Continue to stay safe. Hola y buenas tardes. Fue un placer. Algunas de las primeras vacunas COVID-19 que se administraron en Illinois. Animó a la gente de Illinois que se vacunen cuando la vacuna esté disponible. Las vacunas por lo general pueden ser un tema polarizante y COVID-19 aparentemente amplificando la división. El COVID-19 apareció de la nada. Aunque el virus que causa COVID-19 es nuevo, hay otros tipos de coronavirus que circulan cada año. En este sentido, el coronavirus es similar a la influenza. Hay muchos tipos de gripe diferentes y ocasionalmente vemos una ventana emergente que es nueva, como el H1N1. Se desarrolló una vacuna eficaz contra el H1N1 y durante la última década se ha seguido incluyendo un agotamiento de H1N1 para combatir la influenza. Nuestra capacidad para crear vacunas seguras y eficaces en un periodo de tiempo más rápido crece cada año. Nuestro proceso científico ha evolucionado y ya no se necesitan años para desarrollar una vacuna. A medida que la vacuna contra COVID-19 continúe desarrollándose, haré todo lo posible para frenar la desinformación que vemos. La vacuna no contiene un chip de rastreo. No hay evidencia que demuestre que causa infertilidad. Y recibir la vacuna no te da el virus. Puede ser fácil ver algo en Facebook y tomarlo como verdad. Quizás es una historia que alguien ha escuchado de que el virus no es real y no se necesita una vacuna. Durante estos tiempos difíciles en los que todos buscamos respuestas, invito a la gente a que mire el trabajo de líderes científicos y de salud y confianza. Hoy informamos 7.359 nuevos casos de COVID-19, para un total de más de 863 casos en Illinois. Hemos recibido informes de 117 más muertes desde ayer, lo que eleva el número de vidas perdidas en Illinois a más de 14.500. Esta noche, 4.965 personas estaban en el hospital COVID-19. De ellos, 1.057 fue la unidad de cuidados intensivos y 598 personas estaban en ventiladores. En las últimas 24 horas se reportó más de 92,000 pruebas para un total de más de 11,9 millones de pruebas. Estamos empezando a caminar en la dirección correcta. Bienvenidos al principio del fin de la pandemia. Todavía nos quedan meses, pero continuemos siguiendo la luz al final del túnel. Las vacunas y los comportamientos de salud pública nos llevarán ahí. Muchísimas gracias para su apoyo. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezekiel. Happy to take questions from members of the media.
Governor, good afternoon.
Good afternoon.
Hospitals that were expecting to receive their first shipments yesterday, and they're still waiting, and they don't schedule workers who can get vaccinations today. That's not happening. What is happening with these shipments? Where are they delayed?
They're not delayed. In fact, there was no delay scheduled for any of them. Today, there was no delay to any of them. I should just point out that cities like the city of Chicago, New York, etc. States receive their shipments more than the state of Illinois. We have not 50 counties that are a priority who had the large higher deaths per capita, and their hospitals that are nearby, but 96 local public health departments that need to receive their separate shipments. So with the state, the shipments come into the state, they have to be repackaged to go to the RHCC, the hospitals, from their local public health department, and bring them back to their counties, and then distribute them or directly to the hospital. For the city of Chicago, they go directly to the local department. I remember we have, as I think I said in my report, 58,000 miles of the state of Illinois in which to distribute these things. So like go is much more compact.
But these are suburban hospitals.
Yeah.
They had delivery scheduled.
They did not. I think they were overly excited about that. We're overly excited. IHA, the Illinois Hospital Association, working with us, working with their hospitals, were responsible for hospitals for scheduling when those things would be some no doubt, others, put it out there that they would be receiving them when they actually weren't scheduled to. But they will be clear. We know the first vaccine in arms. I'm very excited about that fact. Distributions over the course of the week. Vaccines pushed into the arms hospital week, and then we'll be getting shipments that go out as they are this week.
The budget cuts that you just mentioned, is Assembly needs to come here collectively. And I put on the table some very significant ones. I want to make sure that the Assembly comes table their potential cut. We will see where we are. Work hard to defeat that solution. Have really no solutions. They have not on the table. I'm waiting for them to put forward some ideas. I thought $200 million of this cut during this time of pandemic. How's that going to? It will affect, in our view, directly anyway, the servicing of people who have COVID-19 or trying to protect people from COVID-19. We've tried to be very, very careful with the cut that we made, so that we know we live in a moment when the Department of Public Health, our HHS, Healthcare and Family Services, are so vitally important. So we do everything we can protect those departments, particularly those areas where it affects the servicing of people who get COVID or protecting people who get COVID.
We'll go online. Available at the bond buyer. Can you confirm the MLF borrowing was finalized today, and can you say how much more cuts you will press for a site next month?
No, I can't confirm that. I can't confirm yet the MLF borrowing has been completed. As to cut or to deal with our budget deficit, and this is the first step. I'm waiting in this, and not just being averaged out to the General Assembly, in particular to the Republicans, because they have a special responsibility here, having worked so hard to defeat the fair up to the plate and tell us how they're going to balance the budget. We have a $3.9 million deficit, and about half of that come structural challenges that the state has. So I hope they will step up to the plate, because they defeated the best solution to the structural challenge.
Tony at the Washington Post. Senate Democrats are saying they may have to drop state and local fiscal aid and the stimulus package for the years support approach, and what effects would it have?
We want to make sure we come to the most people in the United States. There's no doubt about that. It's surprising and surprising just supporting working families across the country. And I'm not talking specifically about local funding. I'm talking about return. They wanted a smaller and smaller package. They were chasing trillions of dollars to businesses, large, but now when it comes to families, they seem to want to cut everything. I'm very disappointed in the entire attitude that the Republicans seem to have at the federal level. I will say there are some good Republicans in the Senate who understand that their public seats are challenged by COVID-19 loss of revenues. Big states, large states that are run by Republicans, have Republican legislatures, need support, and they have publicly expressed their desire and need for support. And yet, and the leadership in the Senate have been reluctant; they've been opposed. So that is very disappointing. Hard. I think that they passed it now. Once the new president is sworn in and Congress is sworn in. Remember, we're in a lame Congress right now. So once the Congress is sworn in, the president is sworn in, another opportunity, and the new president-elect has worked very hard to get state funding because, unfortunately, I just want to remind everybody when you support state and local government, what you're saying is you don't support police, firefighters, nurses, social work, the very people that are on the lines that we care deeply about, and none of us want to see mass layoffs, but that's what's happening and will happen as a result of their failure. We need to make sure that the city support that they need.
Bloomberg, what will the $2 billion in MLS borrowing be used for?
Well, for replacement of COVID revenue, losses of revenue of COVID.
Ryan, what are your thoughts on the review board's decision this afternoon to reject Trinity Health's plan to close Chicago's Mercy Hospital?
Well, I think all you know that I believe and have said many times that healthcare is right and not a privilege. It's particularly important that we stand, and that's why I've spoken with the owners of Mercy Hospital Trinity and with a number of potential hires push things along. Something can happen here at the hospital. Ready to go work to whatever that will take. It will understand require the General Assembly to act a hot transformation bill. It should have in the May brief COVID session that everybody in the veto session. Well, the veto session got postponed. Or done away with. And looking at something for Mercy and frankly for many of the other hospitals.
Kelly Bauer at Black Club, we understand recommendations for vaccinations, but will the state lobby to have teachers be for other essential workers?
You can't lobby ASIP. They're not an organization that you can lobby. I think that on the other hand, ASIP is doing a good job. Consider all the different groups that need to be considered. It's very important, spoken out publicly about the need for equity. And so I'm hopeful that ASIP is doing work. Will come out with the next phases. We'll learn more over the coming days, weeks.
Committee Madigan concluded yesterday that and the speaker did not testify, nor has he come out and answered all the questions from the residents of the state. Madigan stepped down as speaker.
These are very true allegations against him. And the next phase of this is clearly in the hands of the general. But I'm really disappointed that with the forum of the committee, that take as an opportunity to answer questions. But listen, the speaker can hold a press conference today, right now, and answer questions, and I would hope that he will.
Dave Dahl had a question.
I think quite a lot of outreach to forward that have been approved by IDH or presented by IDH. They need to follow those plans, and we're answering questions constantly. I bet there's not an hour that goes by that IDH getting a question or a concern raised one county or another, and we're trying to make sure that all of their questions are answered and that they're doing the right thing for the people of their county.
Mike Militich at Quincy TV. Do you have an exact timeline that seems to be in the hands of health departments in smaller counties without hospitals?
No, there's no. Talk to all the reporters, all the people who are listening. This is a business operation to all 196 public health departments, all the hospitals within the jurisdictions. They're very hard. The local public health departments are the regional, the RHCCs, where we are delivering the vaccine for distribution. So this is going to happen on a timetable. It is happening with a fair and excellent logistics team, and they are delivering. And so confident that over the next 24, 48, 52 hours, you will vaccines being put in people's arms all across the state of Illinois.
Elizabeth Matthews at Fox, and breastfeeding individuals who meet criteria for vaccination based on recommended groups. Is this recommendation by ACOG change your thoughts on whether or not should receive the vaccine? Yeah, I think this is in the second half of it. Hold on. It looks like she's quoting a study from AOD. I was looking for the rest of it, but that pregnant and breastfeeding individual criteria for vaccination based on recommended priority groups. Does this recommendation by ACOG change your thoughts on whether or not pregnant women should receive the vaccine?
So I don't have the recommendation in there, the American College of Obstetrics and Gynecology, but I know that what is recommended is that pregnant women and breastfeeding women can consult with their provider to make decisions. We do know that flu vaccine strongly recommended that women pregnant at every single, even if they're, it's especially important to help protect the mom. And it's not a live virus. Emphasize the COVID vaccine not contain live virus, not killed by virus. It does not have the virus. The virus of pregnant women are told to receive during pregnancy. So, given that we have risks associated with developing COVID-19 in pregnancy, therefore, that is why the recommendation is for pregnant people to consult with their caregiver so that they can decide the best, what's in the best interest, depending on how high their COVID was, if they had comorbid conditions, etc. Those can be made in consultation with their doctor.
Jim, does the state have to step in and make COVID much like the vaccination from diseases that are required in those settings?
Not right now.
Tony Arnold, your last question. Do you favor raising the state's income tax if
I'm focused on the cuts that we need to make in government. We've got to balance the budget. You got to look at both sides, the expenditure side, the revenue side, in order to get there. And right now I'm focused entirely on what cuts can we make, what do we need to do. I want to make sure that the General Assembly and the governor are managing dollars as efficiently and effectively. So that's focused on right now. In the bill that's being right now in the Congress, there are dollars to support the rollout of vaccines for testing and contact tracing. I urge Congress to pass the bill because there's no doubt that every state needs support. This is a 1 month process. This is probably certainly going to go on for 6 months, and of course we're going to be putting vaccines for probably longer than that because there'll be people who just wait until time from now. Well, now looking at what the costs are going to be for the coming calendar year, and that's when our Thank you.